The doctor is in, and the topic today is lung cancer screenings. Lung cancer accounts for more deaths than any other cancer in men and women. And the American Cancer Society has come out with some new screening guidelines. So joining us here today to walk us through these new recommendations is Dr. Scott Ackerman, one of the First Coast's leading oncologists. Thank you, Dr. Ackerman, for being here.
Thank you, Casey.
So listen, these studies were based on, I guess let's even back up. Lung cancer is, you say, is the most deadliest form of cancer that's out there, which I didn't even know until we started this subject. Talk about these recommendations now that came out for people who are smokers and or who are not smokers.
So you're right, Casey. Lung cancer is a very deadly cancer. Unfortunately, many cases are diagnosed in a later stage where it's very difficult to cure them. And in fact, there's more lung cancer deaths in men and women combined than any other cancers that we have.
Incredible. Yeah.
And we've been struggling with this for many, many years on how to screen properly for lung cancer, how to diagnose lung cancer earlier where we can cure it. And I can tell you that in my practice, where I see patients who are at extremely high risk for developing lung cancer, meaning that they already have some cancer, and they also have risk factors associated with lung cancer, that I've been doing some screenings on them over the years and have been able to find some early stage lung cancers in these patients, and we've been able to cure them. But there really hasn't been consensus yet onto what the proper screening should be until now. And what the American Cancer Society did was they did an extensive review of many screening studies that have been attempted for lung cancer over the past 20 or 30 years. And the one landmark study that they looked at was something called the National Lung Screening Trial. In this study, they looked at, it wasn't small, it was 53,000 men and women who were in good health, but who had or at high risk, meaning that they were smokers or they had smoked. And they compared doing annual chest x-rays or annual CAT scans on these patients and found that those men and women who were at high risk that had an annual CAT scan had a 20% decrease in the risk of death due to lung cancer than those who didn't, who had just a chest x-ray. So before, when we looked at chest x-rays and those sort of things, we weren't able to find any advantage in these screenings. But now for the first time, we've been able to find that by doing an annual CAT scan on people that are high risk, that we can decrease the risk of death from lung cancer.
So what do the guidelines specifically recommend, though, for people who might be watching right now?
So right now, the new guidelines from the American Cancer Society are that healthy adults over the age of 55, men or women, who are formerly heavy smokers, meaning that they have a 30-pack year smoking history. 30-pack years, what we use in medicine, it means you smoked 1 pack a day for 30 years, or if you smoke 2 packs a day, it could be 2 packs a day for 15 years. 2 times 15 is 30. If you're someone that smokes 3 packs a day, that's 10 years, is a 30-pack history of smoking. And these are people with a 30-pack year history of smoking who either still currently smoke or who quit within the past 15 years. If you quit more than 15 years ago, your risk of lung cancer is the same as someone who's never smoked. And so you get back to normal. So quitting is a good thing because slowly your risk of lung cancer will go down. But in these people who have a smoking history and who either still smoke or who quit within the past 15 years, we recommend an annual CAT scan of the chest, an annual low-dose CAT scan of the lungs to look for early small lung cancers.
And let's quickly put up a picture here behind us, because there's reasons why we do this. Because what happened here?
So here's an example of a patient who I just saw last week, and he had a history of throat cancer years ago, and he's a smoker. And so on these patients that I still see for years and years, I get an annual CAT scan. This is a CAT scan just done a week ago in my office. And right over here on our lower right, which is the back part, upper back part of his left lung, is a small lung cancer. And this lung cancer is only there. It hasn't spread to lymph nodes or anywhere else in his body. And there's a very high potential that he'll be cured of this lung cancer.
Wow. Really? Just from the screening? I mean,
just from the screening.
Unbelievable.
Here's another view of it that's up in the upper part there.
Okay. All front. Now listen, are there any risks associated with doing these screenings?
Well, with any kind of screening, we talk about risks. We talk about the risk of radiation with mammograms, and certainly there's risk of the radiation exposure in these lung cancer screenings. But more than just that, when we do a CAT scan of the chest and we find something, we may find an abnormal result. They're not always lung cancer. And so we wind up doing tests, invasive tests, biopsies, bronchoscopies, and those things inherently have a risk associated with them. But if you add up all the risks associated with the screening, in lung cancer, the risk of radiation exposure, the risk of complications from the invasive testings. These risks are greatly outweighed by the benefits of screening, but only in high-risk patients, only in
Okay.
patients that are adults and have a heavy smoking history.
Yeah, so I was going to say, your recommendation then being for those people that have the history of the smoking to get the screening. What about people who have never smoked before? Should you recommend this, or
Yeah,
what is your overall recommendation for people watching?
Not yet. We don't
Okay.
have a good screening for non-smokers. The incidence of lung cancer in non-smokers, although it is going up, is still very low.
Okay.
And so it would take a lot of X-rays and exposure to radiation and tests that would to be able to find early lung cancer in someone who's at low risk. And so in that case, the risks associated with screenings really outweigh the benefits. So for now, we haven't found a screening test that is that's completely without any problems, so we don't recommend any kind of screening for those people who are at low risk. But what I advocate, it gets confusing, people get overwhelmed by all this screening stuff,
Sure.
and I talk about it all the time.
Yeah.
If some people get overwhelmed, just dismiss it. Don't do that. I strongly encourage people to stay on top of their health, to pay attention to screening guidelines. We have screenings in place because screenings save lives, and let it be your life that's saved with a cancer screening.
Couldn't agree more. Dr. Ackerman, thank you so much
Casey.
for being here and the insight and the information and sponsoring this segment. Dr. Ackerman is with us every Friday. Next week, we're going to be talking about lymphedema and what that is all about. And for questions regarding today's topic or any other health questions that you might have, no matter what it may be, just visit firstcoastoncology.com. Confidentially submit your questions to Ask the Doctor.